Passive range of motion, PROM. This is the content for this video. Are you ready now? Let's go! Wait, before we start, do you know what is ROM? According to Pedretti et al. In 2013, ROM or range of motion is the amount of movement that is possible to a joint, and it is divided into three. Firstly, AROM, active range of motion, when joint is moved by the muscles that act on the joint. PROM, passive range of motion, when a joint is moved by an outside source. And assisted active range of motion, AAROM, when the joint is moved by individual's effort, followed by an outside source. Since our topic for today is PROM, I will explain in depth what is PROM. Klein in 2007 mentioned that PROM is the ability of a joint to be moved through its normal range of motion while relaxed, with motion being performed by an outside source, such as the therapist's hand, the client's opposite hand, or gravity. And Caulfield in 2015 mentioned that PROM exercises are passive movements of a joint through its available range. PROM movement incorporates an external force to move the joint and therefore does not involve active muscle contraction. There are 6 types of movable joint that may influence the degree of ROM. Number 1, ball and socket joint, where the rounded head of one bone sits within the cup of another that allow 300 degrees movement, such as the shoulder joint or the hip joint. The second one is the hinge joint, where the two bones open and close in one direction only to allow 180-degree movement, like a door, such as the knee and the elbow joint. Next is the pivot joint, where one bone swivels around the ring formed by another bone, such as the joint between the first and the second vertebrae in the neck. Gliding joint, or also known as the plane joint, smooth surface slip over one another that allows limited movement, such as the wrist joint. Number 5, the saddle joint, such as the base of the thumb joint that permits movement back and forth and from side to side, but does not allow rotation. And lastly, the condyloid or the ellipsoidal joint that permits all movement except rotation, such as the finger joints. The main purpose of PROM is to improve motor function and mobility. This is due to the changes in the sensory and motor cortex when movement is made. The second purpose is to reduce pain and edema. Elevation of the heart rate for sustained periods help the body to release endorphins that carries opiate. The opiate will then reduce the perception of pain to the individual. When PROM is done on an individual, it will cause lengthening of the muscle. Lengthening of this muscle will then increase muscle flexibility and prevent joint contraction. PROM is suitable for patients with fracture, paralyzed or in comatose state, has contracture, and also experience pain during active range of motion. However, needed to be addressed that although PROM can be performed on fractures, precaution should be taken for early stage fracture or early stage of ligament or tendon injury. Klein in 2007 mentioned that PROM by an outside source may be performed too strongly that will re-injure the healing bone or ligament. Now I will explain on the procedure of PROM. Firstly, ensure client is in comfortable anatomical position with arms at the side, palm facing forward. Maintain good mechanics and posture. Next, if muscle spasms are present, slowly move the joint to the point of resistance, then apply gentle, steady pressure until the muscle relaxes and continue the motion to the joint's final point of resistance. And lastly, move the joint to the point of resistance and stop when the patient feels pain. Never try to move a joint beyond its free ROM. PROM should be performed twice daily, morning and night, or until patient feels pain or discomfort. During the stretch, each movement should be held for around 15 seconds and every movement should be repeated 10 times. Grading should be increased in frequency, such as twice to thrice daily. Kim et al. In 2014 wanted to evaluate the effects of early passive range of motion exercise on the upper extremity function and ADL in patients with acute stroke. The patients were divided into two groups, the experimental group and control group, where the experimental group performed PROM twice a day. The result shows that the experimental group improved significantly in the range of motion, upper extremities function, and ADL, and also significant decrease in the edema compared to the control group. Mogi et al. In 2019 mentioned that total passive ROM significantly improved in each finger after 3 years of finger stretching. Most patients improve or maintain total passive range of motion and hand function within 9 years after their first visit. In 2011, Jensen et al. Did a study on patients with knee osteoarthritis. They were divided into 3 groups: strength training group, exercise therapy group, and exercise with additional passive manual mobilization group. Results showed that exercise therapy plus manual mobilization showed moderate effect size on pain compared to strength training or exercise therapy alone. And Dundar et al. In 2009 mentioned that CPM treatment provides better response in pain reduction compared to the conventional physiotherapy treatment protocol in the early phase of treatment in adhesive capsulitis. Perform regularly, PROM exercises may help prevent joint contracture as well as soft tissue shortening. PROM Also, maintain movement across fascial planes and augment lymphatic flow, Colfit 2015. And Asadullah et al. In 2013 mentioned that passive range of motion exercises combined with anti-contracture positioning is more effective in reducing scar formation and prevent joint contractures than anti-contracture positioning alone. A study by Nasrallah et al. In 2019 demonstrated that proprioceptive inputs produced by a PROM exercise can activate primary motor cortex and the supplementary motor area orchestrates the proprioceptive motor integration using the feedback mechanism. Hosseini et al. In 2019 did a study on stroke patients and divided them into experimental and control group. The experimental group received PROM 4 times a day for 1 month, and the control group did not receive any intervention. In the results, the experimental group showed significant improvement in motor function compared to the control group. In conclusion, there are multiple types of ROM, and PROM is defined as joint movement moved by an outside source. Types of joint influence degree of joint ROM. PROM does not only improve motor function and stability, it can also improve flexibility, reduce pain and edema, and prevent joint contraction. And although PROM can be performed to fracture patients, caution is needed for patients at early stage of healing. And PROM should be performed twice daily by holding each joint movement in 15 seconds with 10 repetitions.